You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to a special series from the Pharmacy Podcast Network with exclusive coverage of the Cencora 2025 ThoughtSpot Conference. This three-part series, sponsored by Outcomes, takes you inside one of the most important gatherings in community pharmacy. ThoughtSpot brings together independent pharmacy owners, operators, and healthcare leaders to share innovations, tackle challenges, and shape the future of care. Across these episodes, we'll deliver key insights, industry voices, and the tools and strategies helping pharmacies thrive. ThoughtSpot acts as a catalyst for the future of community care, sparking together the minds of those in the driver's seat of change. We're bringing you to the showroom floor, right here on the Pharmacy Podcast Network.
Here's a special interview with one of 2024's most influential people in pharmacy, Dr. J. Phipps, the Pharmacy Gladiator.
Hey there, this is Todd Ure, Pharmacy Podcast Network, and I'm here with one of the 50 most influential people in our pharmacy profession. It was awarded in 2024 for the Pharmacy 50, Dr. J. Phipps. It's so good to see you here, Jay. How are you?
I'm doing great. Great to see you, Todd.
It's great to see you, too. All right, let me just ask you this question. Why do you think your own people in your own profession took the time to vote you as an influencer? What's it mean to be an influencer?
Number one, I'm going to say that it's great to be. It's very humbling when you're voted as an influencer, and the thing that I get from people is that they can feel my passion. It's palpable. I love the profession. I love people. I love pouring into them, and that I think that really resonates with people. And it's an honor to do that. But I don't do the stuff that I do on social media. I don't do that for anything but because I love it, and I love to be involved with people and learn about them. And when you're walking across the trade show floor like today, and I met a young lady a few minutes ago, and I said, "Hello, I'm Jay Phipps." She says, "I met you on TikTok. I know who you are." And to me, that's exciting.
Yeah, but you know what? It's your attitude, Jay. You're not out there trying to blow yourself up. You're out there trying to help people, and you're using your platform to help people overcome fear and overcome distress and overcome just stress in general. And that came from your own heart and what you experienced. And when I interviewed you based on the disaster that your own community felt with the flooding that you actually experienced, and I looked at the tears in your eyes and how passionate you were about your community, that's what made me love you and think I need to support this guy. This guy is a true fighter for his community. And that's inside pharmacists per se, but sometimes pharmacists are afraid to get to that next level. So talk to me about the Pharmacy Gladiator. Talk to me about overcoming fear, because you've really dialed into this.
Yeah. Several years ago, I was trying to think of how do we really identify as pharmacists? Pharmacy, community pharmacy specifically, a lot of challenges. We still have them now, but a couple years ago, just seemed like we were getting pushed around. And I woke up in the middle of the night and said, I'm a gladiator. And immediately in the middle of the night, bought the URL pharmacygladiator.com at 2 a.m. and because I really do think we're really battling in a coliseum every day. We're battling for our patients, battling legislative activities, battling the financial barriers that are put on us, and most of the time, pharmacists are oftentimes a little reserved and not really battle ready. But I think the profession is ready to be battle ready now. And I really do think we're fighting hard to conquer the coliseums in our communities. And really, it starts with fear. And less than 3 years ago, it's hard to believe this, I made my first video and put it on social media. I was at a conference in July 3 years ago. And I'll be honest, it took me about 25 takes to get my 30-second video on social media. And it was fear. And I have, I've got a family history where, my mom has a lot of fear, overwhelmed with fear. And I never really thought much about it until the last several years. You start reflecting on it. And because one of my friends asked me, said, well, while you're an entrepreneur, how do you do the things you do? How do you speak on stage? And I said, it was because of my mom. And they said, well, was she fearless? I said, absolutely not. She had tons of fears. I started making a list. Lots and lots of fears. And what that did is you either have to be overwhelmed and paralyzed by fear, or you have to face it and conquer it. And that really has changed my perspective. And to me, the Freedom from Fear Tour is trying to empower people to revolutionize their life and to flip that fear narrative. And to me, it's extremely exciting when you start seeing other professionals that are, have fear impacting them, and it impacts all of us. It's procrastination, perfectionism, imposter syndrome. But to be able to see them conquer that, face that challenge, and then act boldly, to me, it's extremely exciting. And so I'm willing to put myself out there and be vulnerable on social media and in person. I'm authentic. What you see is what you get. You will get me the same on stage as you do sitting here in a conference, or if we were sitting somewhere else later having a beverage. I'm just Jay, and I think that resonates with people.
Well, I think that what else resonates with people is your sincerity and your consistency to constantly bring this up. Every single one of us, every single human being on the face of the earth has experienced some kind of fear. And we have to overcome that in order to get to the next stage in our lives. But more importantly, if you remove the fear, guess how much more help you're going to be able to give other people. So removing fear isn't just about your success. It's about the success that you're going to provide other people, that you're now showing an example of what you're doing, either as a healthcare provider or as a father or as a husband or as a friend or whatever it is. I constantly, this is a strange story, constantly felt fearful of trying to pray with my wife because I felt that I wasn't a very good prayer maker, and I felt weird about it. And I even told this happened about 3 years ago, told her, and she's like, anytime you want to pray with me, it doesn't matter what you say, grab my hand, let's pray together. And that was a stupid fear that I had to overcome. It was that simple stuff. Or fear with communicating with my 13-year-old daughter. She says skibbity and riz and all these crash out dad. And of course I use those terms to make her laugh, but down deep inside, I had a fear that I wasn't going to be able to connect with her anymore. Those are the kinds of things that are holding us back from those fulfilling relationships. And that pours out into our customers as pharmacy owners too. So talk to us a little bit more about how you've helped to overcome your own fears. And now you're turning around with the Freedom of Fear Tour, and you're teaching other people, other pharmacy owners, how to overcome that too.
Yeah. Great story. Actually, I will use that again about you praying with your wife, because fears don't have to be to make sense to other people for them to be fears. They don't have to really. They don't have to be the same fears that you have and that I have. We all have different things, and they impact us very similarly, though. There's a study out of Stanford that showed that when people are exposed to fear, there's three things that happen. You fight or flight. Everybody knows that.
Yeah.
And then there's freeze. And freeze is what most people do, which is not praying with your wife because you're uncomfortable.
Yeah.
And interestingly enough, that is the least stressful state there is. So when you are frozen with fear, your respiration's lower, your heart rate's lower. It's easier. That's why people don't take action. And I think of your fear as a muscle. You're going to exercise your fear muscle. And the only way to do that is to take action and overcome it. There's studies that will show that if you conquer one fear, it will help you with unrelated fears. So by you communicating with your daughter and having those hard conversations with her, or is she going to accept you or not? And then that makes you a better, not only a father, but it makes you a better spouse, makes you a better business owner, a better communicator, a better podcaster, because your fears are going to be diminished. And to me, that my Freedom from Fear Tour has really been great because what I have seen is that every fear I conquer, I get better and better and better at other fears. One of my things, and most people, if you don't know me well, probably don't realize having hard conversations, it's not something I enjoy, and really I should say it was a fear because, again, the science says when you name a fear, you take its power. Your amygdala changes shape. Your fear center changes shape when you name it. So, to name it is the first thing you should do. But then having those hard conversations have become easier as I've done things like, been parasailing and had colonoscopy, got a power of attorney on my parents. I've hired people, I've fired people, I've climbed Mount Hood, I've went kite surfing on what they call a nuclear day, 40-mile-an-hour winds. And so all these things have helped me be a better partner, dad, business owner, teammate, and they can do that for other people as well. It's just taking the action to overcome the fears and then seeing yourself on the other side of fear.
I love it. And now you're going to be driving a Ferrari. You're walking 4,000 feet up in the air on a glass platform. Like, there's other things that you're purposely putting in front of yourself to continue to overcome fear.
Yeah, absolutely. I think there's capital F fears and lowercase f fears. So you think about it like, skydiving, swimming with great whites, which is on my list. I'm super excited about that. My family thinks I'm nuts.
I think you're nuts. I'm not doing it.
Yeah. Those are capital F fears. But the little things like, praying with your wife.
Yeah.
I would consider probably a lowercase F fear. That's not going to keep you from existing.
Right.
But it still has the same impact on you.
Yep.
And, to be able to exercise that fear muscle by conquering the fears, it really has been life-changing for me and hopefully for other people as well.
Jay Phipps here at the Syncora ThoughtSpot 2025. This has been an absolute pleasure to meet up with you. I watch you from afar on social media and LinkedIn, and always am just blown away by the passion and the sincerity in your heart and the way that you reach out to people. I can't wait to continue to work with you. I'd love to have you back on This Week in Pharmacy. And thanks so much for listening. But thank you, Jay.
Thank you very much. And I'll see you on the other side of fear.
Next up, the VP of Pharmacy Insight at Outcomes, Jonathan Grice.
Hey there, Todd Ure with the Pharmacy Podcast Network here at ThoughtSpot 2025. I'm here at the Outcomes booth with John Grice. I've never met you in person. This is so good to see you. Yeah. Welcome to ThoughtSpot.
Thanks, Todd. It's good to be here.
And it's so good to be part of the Outcomes team. If you said to me, we get to talk about technology, we get to talk about where our industry's going. We have a pharmacy owner, someone who understood operating a pharmacy, and now let's fuse that with the technology that's going to help our pharmacists and pharmacies transition from being dispense-based to now becoming paid for clinical treatment tracking services. Like, this is the place to be. I'm so excited to have you here. Please tell our listeners about yourself, because you were a pharmacy owner and you're a pharmacist.
Yeah, you bet. No, you said it well. We're at an interesting point in the world of pharmacy, and so I'm glad to be here talking about it myself. I'm a third-gen pharmacist, just kind of raised in the industry. Grandpa was a pharmacist, then my dad and uncle both became pharmacists. Gosh, after me, I've got 2 cousins and a little sister who are all pharmacists as well. So it's just kind of in the family.
It's in your blood.
Yep. And I was running the family company through the end of 23. We did retail, we did long-term care, specialty, infusion, you name it. We were doing it. Anything outside of the hospital was our mantra.
You must have always had a connection to technology, and otherwise you certainly wouldn't be, partnering up with Outcomes per se. But what was it about your systems back in the day? And now I'm starting to sound like an old guy, but I've been in pharmacy for 20 years, and just like you, your whole family. But talk to us about the transition from pharmacy ownership to now helping other pharmacy owners leverage technology.
Sure. Yeah, the evolution of things, right? I grew up underneath the bench while Dad was swapping floppy disks for new version releases back in the day. And so I've seen all sorts of different innovations in pharmacy. Really, ideally, it's around improve care and reduce the cost. And so at Hometown, we were focused on those same things. But what I've liked about Outcomes and the mission that we embarked on 3 years ago was around how do we take where pharmacy's at and do those two things, but do it in mass. Improve patient care and reduce the cost. And I think bringing together the three companies that our CEO had that vision to do was really key. Bringing together pharmacy management software with Outcomes and then throwing in the prescribed wellness piece to all of that is how we're going to be most efficient at filling scripts, but then helping our pharmacies, enabling them to really embrace the new clinical services, not just in addition to, but like at the same time. And so that was the vision that I caught from him. And I think our team is all motivated around that's the vision that we see pharmacy needing, and we're working hard to provide it.
That's awesome. So when I think of changing systems, changing processes, changing how we work, as our pharmacy technicians are now doing more to support our pharmacists in any setting, it's not just independent community pharmacy. And I think, okay, we've built these new systems, we've built these new programs, and how pharmacists are going to be doing more. That's great. We have to do that. But we need to be able to measure it. And we have to have insights that give us data so that we know, is it working? And what twerks do I need to make in my workflow, in my treatment programs, in how I'm following up with a client, with a patient? Talk to us about insights. Talk to us about the importance of data and what you guys are planning on rolling out and continuing to grow.
Sure. And the way you describe that, it's kind of two sides of the same coin. We've got to follow the dollar. I had a really intelligent pharmacist when I was really green tell me, just follow the dollar and you'll find your way.
It's true.
We've also got to invest in the research, understanding our own business, really knowing what we're doing, why we're doing it, to know where's the dollar at, or maybe to illuminate different opportunities that we're not actually seeing yet. And we're not truly doing the right things. We're just doing what has always been. And so our product pharmacy, RX Insights, or we just shortened it to Insights basically, but Outcomes Insights is a tool for basic business intelligence. Every PMS has its own reporting module. And then the savvier users will apply a BI tool on top of it. And there's a number of good ones at every trade show. Our Insights is a tool that does that same thing. Our vision with it, though, is to be able to make it so user-friendly that it doesn't have to take an hour or two that you invest in the office, sitting there running reports or trying to distill them down. You can get to the point where you know exactly what you want. Either it auto-generates and sends to you, or maybe even it's as intuitive as ChatGPT that more and more pharmacists are just using in their personal life. They may be able to ask questions of an LLM like that and get the insights that they need. And we could really change the way we think about data and we think about our own pharmacies when we get to that stage.
So I was saying the need to develop new processes and how to use technology to get us where we need to go, doing a lot more hands-on and treatment tracking. Now we're talking about the reporting. Now we're talking about, hey, Insights is now going to give us, here's how things have progressed. Here's the revenue we're generating. Here's the gaps of what we can do. All right. Now I'm listening to you as a pharmacy owner. I might even be a user, right? And I'm thinking, is this something that I have to upgrade, or is it already integrated? Like, how would I get started in using Insights?
Well, right now we have it available for any of our RX30 customers. Insights is just a free flip a switch, turn it on.
Okay.
So our users are already using it, but it's continuing to grow and expand already. And so, if you're on RX30, just ask.
Okay.
We'll turn it on and teach you how to use it, and you can start playing around today.
So Insights is a really important tool to change management, and change management leads to better outcomes, literally.
Yeah.
But if you don't have a leadership map, if you don't have a leadership roadmap, if you don't have like a thought of like, how do I take my team, gather my teams, gather my clients, even gather people in my community, my nurses, physicians I'm working with, we have to be leaders to help this change management. So talk to us about how important it is. We can talk tech all day. We can nerd out. Of course, you and I could probably talk for hours and hours. It'd become like a Joe Rogan episode, but
It'd be fun.
it would be. But the important thing is that we're helping to guide our operators to having all the pieces of the puzzle. And you're going to have strengths in some, and you're going to have weaknesses in others. You're going to come back to the outcomes team to backfill a lot of that insight stuff and the data and stuff. But let's talk about leadership. Let's talk about how are we going to embrace every component of the people that I just talked about so that ultimately our patients getting the best patient care and health care, but I'm also helping to transform my community.
You got it. So it starts with that research almost. As you look around the pharmacy space today, we see two major themes, right? Costs are going up. Everybody's complaining about the high cost of drugs. And at the same time, pharmacies are going out of business. We're seeing headlines, closures, all that good bad stuff. How is that true? How are both things simultaneously true, that a market or an industry has inflated costs, way too expensive, and everybody that's doing that thing are going out of business? Well, clearly we have value misaligned. We have dollars flowing to places other than where the value is being created and delivered.
Right.
Well, how do you change that? You got to shine the light on what is the value and then start orienting people's, basically their financial models around those metrics that matter. We've gotten a little off base. I'm not sure where to point the finger exactly, but I do believe that metric is still out there. We're just not playing Moneyball right now and finding it. And that's what Insights is going to be able to do. And that's what I think the whole industry needs. Everybody's going to resonate when we say, look, the pharmacists are providing value to the patients, but if they can't answer the phone because they're so understaffed and overworked, then there is no value being created. You can cut their reimbursement or cut the drug cost all you want. You're just making the problem worse. We've got to reverse that somehow, and not just in a pay them more. I hear a lot of well-intended cries for legislation and things like that drive to a minimum dispensing fee. I endorse some of that, but at the same time I go, is that the best? Is that the right solution overall to get the Moneyball metric that makes everybody happy, that gets the patient taken care of best, that's first and foremost, but keeps the pharmacies viable, keeps the drugs and the drug companies happy, and of course the payers then are going to be the ones responsible for making sure that the metrics are all working. So that's our goal. That's our vision, or the leadership that we're trying to provide to the industry, is we're going to find it and we're going to keep moving everybody towards that new metric, if that's what it is, or that mindset of that the current system has these problems. Let's find the new.
And the current system is broken. We're getting better. We're seeing things change. We're seeing pharmacists take leadership. We have two people in Congress that are pharmacists and pharmacy owners, Buddy Carter and Diane Harshberger. Yep. So representation of pharmacy as leaders, as leadership, it's there. If you're a community pharmacy owner, you are a leader in your community. Your community trusts you. Therefore, take advantage of all of your operations. Take advantage of your computer systems and your packaging systems and your infrastructure. Bring in your Congress people. Bring in your state representative or your state senator. Reach out to them and say, hey, I want you to come in and do a tour at my pharmacy. I want to show you a report and give you insights into how our pharmacy specifically is saving X number of dollars because of what we're providing. And if we could use technology, even an insights report that could be built just for we'll call it the Insights Politician Report, right? But we'll be able to show them, hey, this is the impact that we're having on this community. Therefore, it helps give them ammunition to go back and fight for their constituents and saying, here's how PBM reform could really revolutionize pharmacy care.
That's a great example. It's a great idea for how to actually accomplish that. It's also been the main goal of outcomes from its beginning, right? Like, you're already providing this care, document it, and then get paid for it. And so that's what we're trying to do with outcomes, is make it easier to document the care you already provide, the best interactions that when those legislative visits happen. It's not a nice fancy report that gets plopped down for the good senator to look through. It's watching that pharmacist interact with their patient right over the top of the counter. Then whoever it is standing there is able to go, wow, look what just happened. Now what just happened? And they'll ask kind of a question or have a conversation about that patient smiled, walked out of here, maybe bought something, maybe didn't, right, but is now going to be on a whole different path than they were just 10 minutes ago. And the pharmacist was the one that had that conversation that made it happen.
We're doing multiple pieces of this, and what this leads us to is evidence-based outcomes. And it's literally that, because now you're taking every piece of what we're saying, your technology, your operations, sprinkling in your local community and politician, everything that you're going to need to really lead us to this next phase of pharmacy care and community pharmacy care. Community pharmacies are the future of keeping our nation healthy, because of the deserts that are popping up all over the place. So we have to have ways of filling in those gaps, and outcomes is definitely a part of it. John, this has been amazing talking with you. Really appreciate this time
man,
with
you
you.
too. I appreciate it. Thank you.
All right. We're here at Outcomes booth 132 here at the ThoughtSpot 2025, and we'll be back with more. Stay tuned.
Mark Nelson, Vice President of Retail Pharmacy at Outcomes, shares his thoughts about the future of community pharmacy.
Hey, we are here with Mark Nelson, who actually is a veteran. Mark, it's unfortunate for us to have to accept this time of our lives, but we're now the veterans. And when you and I entered pharmacy, I think we entered in the same time, about 2009-ish.
Yep.
We were like, what, other than we thinking we knew what pharmacy was, but you played a very special role in the evolution of pharmacy technology and in pharmacy systems. And there's experiences that you have. We're always so intense where we're trying to serve our customer. We want the independent pharmacies to evolve and leverage technology, but there's stories within those years of service and the years of looking out. And I just want to hear from you. And if the listener doesn't know, you've been part of this industry for quite some time. You've learned a lot, and now you're Vice President of Pharmacy Services here at Outcomes.
Correct. Yep.
And just share with a little bit about yourself and your story.
Yeah. So I guess we'll start at the beginning. I entered pharmacy in 2009, and like you said, I didn't really know anything about pharmacy. I was kind of a nerd at heart, I think. I focused on IT. And so when I had the opportunity to join a company and help build a product for community pharmacy, so I'll give it a shot. Interesting, the point you made. It's my entire career has been helping pharmacies embrace change. Because even from the very beginning, we were coming in with this new revolutionary product, and we were met with a great deal of resistance up front, because, well, this is the way I've been doing it for 20 years and it works, so why would I change? So we're coming in with medication synchronization, and it's this mind-blowing thing at the very start. And so you're kind of having to lay the foundation to say, what you're doing isn't going to take you into the future. You have to embrace the change, and here's why. And really, that's been the story of my career. And I think that's a trend within community pharmacy. It's it's always there. What's that next thing that's going to help set these pharmacies apart? And so, that was the first 10 years of my career, and it was an amazing experience. After that role, I don't know if I should actually say it or not on this podcast, but after that role, I joined a company called Gartner, which was phenomenal from a personal growth standpoint. So for those that don't know, Gartner is a global healthcare analytics and IT analytics company, but 40,000 employees across the world. Just so much different than working in community pharmacy. But the experience you get from that is, here's how a very well-oiled machine operates. And here are the guardrails that they put in place to make people's jobs very efficient. And I think there was a lot of synergy with Outcomes. And so when they approached me, it was like, hey, I've actually not been directly within independent pharmacy here for 3-4 years, but I love it. And it's, and I will say, like, every day I'm on LinkedIn looking at, like, what are all my friends doing? What are those people that I formed those relationships? And it's something that I'm just truly passionate about. These are my friends. And I think the great thing when you're a vendor in this industry is you actually play a critical role in helping these people like accomplish what their dream was. I want to open a pharmacy and support my community and support my family and make people healthier and, be successful in the process. And when you get to be a part of that journey for someone, it's, not to be altruistic about it, but yeah, I'm selling something, but it's easy to do when you know that you're doing good at the same time.
Yep.
And so, Outcomes approached me and transparently said, "Hey, we're trying to flip the script. No pun intended. We've got this new vision. We have this product called Outcomes Premium, and we're focusing on the clinical and medical billing and just a different approach. And so there's a lot of synergy between my previous experience, right? Is take all this new technology and then help not convince, but show people why they need to embrace that change. One of the things that I've said, kind of my talk track with my team is why this is important and why I really wanted to get behind this and be a part of this team is that if, my previous experience was all about filling prescriptions, how to do it easily, efficiently, and how to have all those tools in one place. But if I fill 100 more prescriptions today than I did yesterday, I mean, realistically, that's not really moving the needle entirely. It can become a staffing capacity issue, just bandwidth, cash flow. There are a number of challenges on it. And reimbursements aren't phenomenal in a lot of scenarios. True. But if I can start doing point of care testing and medical billing, and let's say you do 20 of those in one day, like that can be game changing to the pharmacy. And so that's what I'm here doing is trying to, take pharmacy to the next level. We think the future is clinical and help them, still got to do all the filling and that you still need that portion.
Yeah.
But when you add the next phase on, like, it's pharmacy as a healthcare provider, which they've already been doing anyways. We just need to get them recognized and paid for it.
Mark, I don't know if this is controversial to say, but maybe it's not even pharmacy anymore. I mean, pharmacy's been my life for 20 years, but maybe it's community health because we're moving away from the dispensing fee as the only way of getting paid, and we're doing pharmacies in the community, independents that are here at ThoughtSpot. They're committed to their communities. They're part of the communities. They're supporting. They're showing up on school boards or they're showing up at city council, and they're really part of the community. But their infrastructure is no longer just a pharmacy. They're doing immunizations. They're doing disease state management. And if they don't have a program like Outcomes to pull that data in and get paid for it, they can't evolve. But I wonder. The word pharmacy to me, the layperson doesn't understand this. It would be us inside the industry, the people listening right now. You'll get this, and that is, pharmacy isn't what it was 20 years ago when you and I entered the space.
No, nothing like it. And I've said that, like, pharmacy is not what it was 2 years ago or 5 years ago. Like, it changes because you're taking something with technology, which, I mean, it's hard to keep up with AI and all these new things. And then you're laying it over top of pharmacy with constant rules and regulation changes. You mix those two things together, like they're focused on running their businesses. And so that's where you can be like that trusted advisor consultant to say, like, here's this other thing you need to be focusing on. But I love the way you said it, because that is truly how I look at it. Like, you're not just a pharmacist. And I have people say, well, like, well, I'm just a pharmacist. Like, you're not just a pharmacist. Like, I can access you so much easier than my general practitioner. Like, I trust you. And I think that's the way these people's communities feel about them. Like, they're kind of, part of their families. You hear those stories all the time. So, no, I love it. I think it is community health. It's a better way to look at it.
Community health.
Yeah.
Yep. So your mission here at Outcomes, to take all of your experiences. You also did some consulting with an independent consulting group that helped pharmacies kind of like think outside the box.
Yeah.
So all this is now rising up to that leadership position. So I want to shift the gear and ask you about leadership.
Yeah.
When I look back in my days, I would look at Jeff Key, leader, people, the Irene family from Specialty, leader.
Yeah.
But we have to now look at ourselves in the mirror when we get up in the morning and be like, you know what? It's my turn to lead, because I kind of have to. If you're going to be part of this industry, if we're going to be part of this profession, it's our turn to step up and take all these years of what Jeff taught you and what the Irenes taught me and what Jeff, I mean, I think of Earl Hutchison from the Softwriters days. The man, he's passed away since. And all these people that I stood on their shoulders to get to the next level. I want to keep doing that for other professionals.
Yeah.
And I want to shout out to the whole Outcomes team, the young people on the team, the older people on the team, doesn't matter. Realize that people like Mark bring so much more to the table from what our experiences have been than selling a pharmacy management system or selling technology. We've soaked in this entire profession for 20 years. I mean, that's a lot of experience.
Yeah.
So talk to me about leadership from your perspective.
Yeah, no, I like the way you said that. Jeff Key was a phenomenal.
He's a legend.
Yeah, absolutely. He amazing mentor. That's the best way to say it.
The reason why is I trusted where he was coming from. I competed with him. I competed with Pioneer back in the day. I competed with the RX-30 team back in the day. But I trust that what his end game was empowering a pharmacy.
Yeah.
And that was the part that I would stand back and be like, that's freaking cool. Like, I want to have that reputation someday.
Yeah. No, it definitely that was an amazing experience. I'm kind of at a loss for words on it. I could talk all day, I guess, to some degree on that portion of the journey. But what Jeff did was he had a brilliant way of taking very complex situations and breaking them down into easily achievable goals. And I think you saw that in the product that we created at that point. And I think that's one of the PDS speeches.
Yeah.
Where they talked about the journey to the North Pole.
Hurrah.
Yeah. And the one group that went all the way there and then froze to death versus the one group that's like, hey, we're going to plan this out and do it very strategically. And that was the journey. And that's the way he led the team and helped grow the people underneath them. And that was a really important thing, was the way he empowered the people underneath to take risks and to make decisions and to get out there and then kind of aggregate all of that insight into, all right, let's take all this information and try to make it make sense and make it actionable, I guess is the best way to say it. So, me being in a position to do that with the team, like I'm honored, truly. And, I've been with Outcomes for 6 months now. And the first part of my journey here has been building a new team.
Yeah.
And so, I was just telling somebody a couple minutes ago, like when I was posting the first jobs that I had open and I had people reach out to me, like I had Mark Amu, who you're going to talk to here in a couple minutes. I worked with him when he was with Bartell Drugs, for 10 years. Phenomenal guy. When he reached out to me, I was like, oh, you're hired. Like, I got to do a formal interview process, but like in my mind, like you're hired.
Yeah.
But those are the kind of people, these clinical pharmacists, just the passion just oozes out of this guy. And that wasn't where I started with this journey, but that's the team that I've created. And looking for people that share that vision is like, when they care about community pharmacy, they don't have to be expert salespeople.
Right.
But if they're passionate about this, like truly, like if it's in their heart and they want to help these people succeed, like then the product kind of sell themselves to some degree, because you will find a way to align that with what they're trying to do. And again, Outcomes has an amazing suite of products. And how do we present that in a way that's, transparently not complicated? Because I think for a while it was a little bit complicated. It's, is it prescribed wellness? Is it telepharm? Is it, RX-30? Is it Computer X? And, even 6 months ago, people were asking me, and well, I'm not entirely sure. I'm trying to figure it out right now. And so, we've unified that vision. I think we've really made a lot of headway as far as here's where we're leading with this Outcomes premium, and the future is clinical. And again, the filling of a prescription, it's still important, but it's not what you're leading with today.
Right.
For years, I led with, we got to fill prescriptions more efficiently. And now it's like, yeah, we got to do that. but we really have to think about all these other things too. And so where can we look for efficiencies in the pharmacy, with counting technology and IVR and automation? Because first thing most of the pharmacists come to me and say is like, okay, all this clinical med billing, MTM opportunities, it's great. Where am I going to get the time to do it?
Mm-hmm.
And so now we got to back up and say, okay, we got the filling portion done, but if we could add in, count technology, how much time does that save? And you try to kind of bake it out and show the ROI of invest in some other areas to open up your time, because that's time is the currency, right? Like they don't have more time, and we need to kind of find that. So, back to the leadership portion, I'm trying to build a team, and I have, that feel the same way I do. And I think we're in a really, really good spot moving forward. And I'll give a shout out to it. Like I owe that to Jeff, because I wouldn't be here if he hadn't given me that opportunity 15 years ago.
Yeah, and it's like now it's your turn. Like you have to look at the younger generation up and coming, and we have to instill in their hearts that this means something. This isn't just a job. This isn't just us. We're here to make sure that pharmacists are winning, and that part of that winning is getting paid, and part of that winning is being able to do more for their patients because their patients desperately need them, because it's the only medical provider that they're seeing 9 times more them per year than they're seeing their own physician. So this is a mission, and I trust, just watching your career over the years, I trust in you too, because you've been a leader and you've been someone in the space. And congratulations on joining up with Outcomes.
Thank you. I
want to invite you to maybe meet up with me on my show This Week in Pharmacy sometime, so we can talk shop.
Yeah, no, anytime. And I add to the one last point you made. Everything we do, we're looking at what's the trifecta win. So I don't look at any of these situations in the team that we've put together. I don't want them ever looking at like, how do I win? It's the pharmacy has to win, and if that happens, then the patient wins, and then we win every single scenario, because if they win, we win, and that's how we have to go into it. And again, we're supporting an amazing community, and I missed being a part of it, so I'm extremely happy to be back.
It's great to see you still here and being part of pharmacy. We're here at ThoughtSpot 2025 here at the Outcomes booth, and we'll be right back.
We welcome back pharmacist Heidi Polek, the Vice President of Product Management at Outcomes.
We are back at ThoughtSpot 2025, and Heidi's back. You know what? It's usually one podcast per 2 to 5 years, and now we got 2 done with you in one weekend, so this has been a treat for me.
This has been a treat for me as well. I'm always hunting you down when I'm at trade shows because I love talking with you.
Well, people have been saying your name. I talked to Mark Nelson, who's joined the Outcomes team. We're talking about leadership. We're also talking about the veterans that we have to embrace the fact that we're the people now leading this industry. Our experiences for the last 20, 30 years are now cultivating to a point that it's our turn to step up and take the responsibility and accountability. And part of that is the drill down nuances that people like me are not good at. And that's like the accounting. Don't give me the accounting book, because then we'll go out of business, because I'm not good at that. Or reconciliation of prescriptions. And so people like you, Heidi, are so important to our pharmacy owners, because you understand things from multiple points of view. So let's talk about reconciliation, because things have come up, things are changing fast. You started telling me before we started recording about some of the new bylaws and the way things are going to get paid. So talk to our listeners a little bit about that.
Right. So I did not even really think about reconciliation when I was a bench pharmacist, right? I worked for a large corporation, and someone else was doing all of that. When I moved into a corporate role and I had pharmacies to oversee, my eyes got completely opened to a process called reconciliation. So, I'm just billing prescriptions away, and I don't even think about getting paid for them and making sure I'm getting paid for them, right? So I dumbed it down about a month ago on another on a webinar that I was on, that it's like balancing your checkbook. If people remember what a checkbook is, right? You got to know the money is actually coming in. You're actually getting the money for the claims that you're billing. And it's just getting more and more complicated. We had something happen in 2025. So all of 2024 outcomes and our pharmacy management systems, RX30 and CRX, we had to go build some new workflows for a process called Medicare prescription payment plan. And that was where pharmacy patients on Medicare could opt in. This was an optional program where instead of paying their copay at the pharmacy, they would be able to walk out the door, not giving the pharmacy any money anymore. Okay. But they would get a bill at home from their Medicare plan. And so that was cash flow out of the pharmacy's immediate hands. It turned into a second receivable on one claim. So now you're chasing two payments for one claim. Gosh. Crazy. Thankfully, I was really concerned about that one as a pharmacist, but, after watching it, we were seeing that really a very small percent of patients actually enrolled. So it wasn't the biggest impact that we thought, but I can tell pharmacy owners, Medicare really wants patients on this. So they're really hitting hard for patients to enroll for 2026. Okay. So that's a 2026 thing coming. Something even bigger is part of the Inflation Reduction Act, is a process called maximum fair pricing. And what Medicare did is they picked a select group of 10 medications, high volume, high dollar. We're talking things like Januvia, Eliquis, stuff that you dispense every single day. Now, that pharma company and that PBM will have what they're calling a fair reimbursement that can be up
I'm excited.
It can be up to 65% less than what you're getting today. But they want to make you whole. I love my air quotes. They want to make you whole by having pharma give you the difference. When did pharma ever give money directly to pharmacies? So again, in typical governmental fashion, they came up with this convoluted plan that there'll be yet a new middleman sitting there helping us get paid. It's called a transaction facilitator organization. Pharmacies have to go enroll with this organization. Your reconciliation company has to go enroll with this organization in order to get the 835s to track this money down. And we've been watching this very carefully because this really, to me, is very scary for pharmacies and their cash flow and bottom line. John Grice, who you spoke to yesterday, our VP of Insights, he's written 3 articles on maximum fair pricing. And in looking at our outcomes network data and analyzing these medications for what I'm going to just abbreviate as MFP, we're anticipating up to a $20,000 a month cash flow problem for pharmacies because of these new, payment plans. And so again, 2 things that you're going to have to track for a single claim. And I'm really excited that our reconciliation team, we've set ourselves up for success. We have enrolled with NCPDP and the transaction facilitators. So we're now well set up to help our recon customers get those new 835s. We knew this was coming and we wanted to be prepared so that we could help pharmacies track this money down. It's so important. I wouldn't want to do this myself. I hope that business owners are not trying to do this themselves. We're talking a minimum of 20 hours a week of your precious time that will be chasing down all of these payments. I absolutely recommend that you work with a reconciliation company of some kind, so those experts can do it. Our team here at Outcomes has been reconciling claims for at least a decade. They've watched what's been going on in the industry. And it's important that you work with a well-seasoned team, because 2026 and beyond is going to be a really difficult time, because the maximum fair pricing is not stopping at 10 drugs. We've already got 10 more identified for 2027. I believe 2018 it goes to 15. So before we know it, practically every drug is going to be involved in this.
Jeez.
Yes.
All right. So if you're listening to the show and this is bringing up questions in your mind, I want you to reach out to Heidi, reach out to the Outcomes team. Our link in the show notes will actually take you to a contact page, so you can get some answers. But you're not here alone. You have an entire organization, lots of people who want to actually help you. Heidi, once again, thank you so much for being on the show and for being part of the ThoughtSpot 2025 coverage.
Thank you for having us. The advocacy that you do for pharmacies is second to none, and it's just an honor to be able to speak with you as often as I do.
We can't wait to have you back.